Hey, 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 good
Good
morning.
morning.
Today we're going to be doing our Birth and Beyond workshop. It's a newer workshop that we have here at New Journey Chiropractic, but it is going to be talking about preconception through birth and making sure that your nervous system is functioning to its fullest potential. So, if you are not a patient here or if you have questions about pregnancy, please enjoy this workshop. But if you have more questions, feel free to reach out to our office. And as always, share this with your friends and family. So today's agenda is we're going to be going over what the perfect storm is. We're going to teach you ways that you can try to best prevent it. We're going to talk about how everything starts with your nervous system, the importance of your nervous system being in balance. We're going to talk about co-regulation, which I think is really cool, and knowing the importance of your family being in perfect balance with their nervous system, the benefits of having a regulated nervous system during pregnancy. We're going to teach you a little bit about what's going on with your baby during each trimester, the first step in creating a healthy and happy nervous system, and how to build your inner circle. So, prenatal care has become very medicalized. When you start talking about a mom becoming pregnant, what is the first thing that they do? They obviously take a test, they tell their friends and family, or sometimes they wait. But when you go to the OB, we start checking blood work, we do ultrasounds, we start taking all of these measurements, and that places a lot of stress not only on the mom, but the baby as well. So, America spends close to $100 billion on birth each year.
That's billion with a B, y'all. That is a lot of I was shocked. That was like my initial response. Like, wow.
What was it? Billion?
Billion. What?
One in three American women have a cesarean section. And a lot of times, guys, this isn't done for medical purposes. A lot of it is done through convenience. The World Health Organization recommends that it's only 10 to 15% at most. But I think if you were to do a deeper dive, you would find out that more women are having C-sections versus a vaginal delivery.
Mhm.
70 to 75% of women receive an epidural during their delivery process. And while it's not bad, it also tends to slow down the birthing process. Yes, we don't want mom to be in pain, but it tends to slow down the birthing process, which can lead to a higher chance of having a C-section. 31% of women are induced. And again, a lot of this isn't being done for medical purposes, it's done out of convenience. We have patients here in the office that at 32 weeks, OBs are starting to plant that seed of starting the induction process if baby isn't here by 38 weeks. Guys, I've had moms that cook babies until 42 weeks and it's completely normal. As long as the baby's healthy and the mom is healthy, we don't need an eviction date as early as 38 weeks, but we can dive into that at another time. 1 out of 7 women experience a postpartum mood disorder or have anxiety disorders. The fertility market in 2022 was estimated at 7.9 billion, and they're estimating in 2028 that being at 16.8 billion. And then 65% of women are on a hormonal birth control. And so when we start talking about prenatal and just being a woman at the age of being able to deliver a baby, like we're doing a lot of stuff that is shifting how our body was created, how our body was designed. So we're going to go over what the perfect storm is and teach you a little bit about ways that you can manage that with not only your health, but your baby's health. So, the perfect storm is exactly what it sounds like. It's a cascade of events or interventions, such as prenatal stress, inductions during labor or to create labor, epidurals, birth trauma, forceps, C-sections, and the emotional state of mom and baby. There are other factors that can lead into it as well, but these are some of the top reasons that the perfect storm can start. And some of these things we can minimize and some of them we cannot, but being able to understand like what causes the perfect storm and how to get out of it is going to be important. But what we see in our kiddos and even adults, we don't always label it as the perfect storm. But what we start to see in our babies is an infant will come in with colic. They'll come in with ear infections. They may be experiencing constipation. Later, it can turn to SPD, or ADHD, autism, and then the list kind of goes on. A lot of our parents are taught that kids will grow out of ear infections, they'll grow out of colic, they'll grow out of constipation. And while that may be true, if that nervous system is impacted, which is causing that colic or that ear infection, if we don't address it, it turns into things, maybe ADHD, maybe SPD, maybe other things as they get older. So it's important to create interventions sooner rather than later so we can get these children out of the perfect storm.
Yeah, a lot of parents come into, and I hear it so many times. Oh, my pediatrician said we'd grow out of it. We'd grow out of it. We'd grow out of it. You don't grow out of it. You grow into different symptoms. 100%.
Full slide. Okay. So how do we try our best to avoid these cascade events? So knowledge is power. And so what we try to teach, maybe by doing a pregnancy workshop or other workshops in our office, but we try to teach you and to empower you on different things so you can make better health choices. So Stephanie, what is your favorite line?
When we know better, we do better.
I don't even find I say that more. So 80% of birthing or the birthing process is mental. The remaining 20% is going to be physical. And so what we have found is the more that you are educated, the more you know, and the more that you'll do the best that you can during this process. Preparing in advance. So do preconception work. A lot of women are told, or the thought process is that this is her body that's creating this human being and doing all of the work. Well, I want to tell you this. Mom and dad both matter because it takes both of you to create that process. So if you're planning on getting pregnant or you have thoughts about becoming pregnant, it's really important to make sure that mom and dad are both healthy before that pregnancy starts. So that way you're giving that baby that optimal chance of avoiding that cascade of events or that perfect storm. Nervous health or nervous system health is so important because, guys, your nervous system controls every cell, every organ, every tissue in the body, and that includes your mom and your baby. Your circle of people is also important. So you want to surround yourself with people who protect your vision for birth. We always encourage moms to have a great support system, whether it's through family, whether it's through a friend, whether it's through a doula, a midwife, or even just an OB, but making sure that that provider has your best interest. It's that far one on the left. Our light decided to shut off. We might not have light today. It's never a dull moment here. So you want to make sure that that provider or that family or that friend has that vision for what your optimal birth would be, what your wishes are, what you're wanting to do or not do during the birthing process, or even leading up to birth itself. So we're going to go over the importance of balance in the nervous system. This is where Stephanie's going to take the wheel.
So the nervous system is made up of two components. It's called your autonomic nervous system. And if you've been into the office for a scan, then you've heard me talk about gas pedal and brake pedal. So the sympathetic part of your nervous system, we talk about in gas pedal. So that's fight or flight. It's engaged, it's on, it's alert. So it looks a little different in babies than it does in adults. But the parasympathetic part of your nervous system is the brake pedal. So during the day, when we're awake and alert, our sympathetic nervous system is typically in charge. We need to be aware of what's going on. We're hypervigilant. With babies, this can mean that they're fussy. It can show up when they have colic. It can show up when they're having ear infections and they're sick because their body is in protection mode.
Mhm.
When the nervous system is constantly in fight or flight or constantly on the gas, think about it. You're just wound up. And so, a lot of you, and you guys may not be able to see this really well, but we can include this in future postings. But when we do the scans, it looks like raging bull kiddos that are wound up and worn out.
Mhm.
They fight you to go down for a nap. They fight to eat. They fight to get through anything. And it's because their little nervous systems are just so wound up that their bodies can't relax. Well, guess what? The only way our bodies thrive, repair, reset, and restore is when we're in parasympathetic state.
Mhm.
We need to have our foot on the brake in order to reset hormones, repair muscles, reset hormone level, or assimilate nutrients. So we need to have a nice balance of gas pedal and brake pedal.
Yeah, you don't want to be crammed on like both. You don't want to
Yeah.
be slamming on that gas pedal or you don't be slamming on that brake. You want that easy transition between both. Just like you're driving a car, you don't want to be, I mean, you might want to drive with the gas down, but you also don't want to be
No, you're not
stopped
going to
and
go
not
90
moving.
miles an hour to slamming on the brakes. Imagine driving down I-4 with a foot on each pedal. Like, you'll get where you're going, but you're burning a lot more gas. You're wearing out your brake pads. The car needs more maintenance. Same thing happens inside your body.
I was just imagining. Dun, 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 dun,
Oh,
dun.
yeah. No, we have a friend that drives like that. It's not fun. Not fun.
So, guys, it all starts with the nervous system. And so, the central nervous system is the biggest part of the reproductive organ, or is the biggest reproductive organ that we have. And so, your brain tells your body what hormones to make. There's a balance between the HPA versus HPG axis. The HPG axis is the hypothalamic, oh, I can't talk, hypothalamic pituitary gonadal axis, and the HPA is the hypothalamic pituitary adrenal axis. And so these are both neuroendocrine systems that interact with each other to regulate cycle or physiological processes like reproduction, stress, and behavior. So we want to make sure that's in perfect balance. And so, has anybody ever heard of the bear analogy? So
Mm.
that's
I
that
love the bear
fight or
analogy.
flight. Do you want to go over what the bear analogy is?
So, if you are so stressed, imagine you get up early in the morning, you've got to get to work, you've got to fight traffic, you get to work, you have meetings, your boss is like on you because you're late with a project. You get home and the bills are due and the kids are loud and dinner's not done and you're just constantly. Your nervous system does not know the difference between that stress and you being chased by a bear.
Right.
So what happens is you're in fight or flight. So things in other processes in your body are reduced. Think of it as like turning the volume down on being able to ovulate on time. For women, think about like when you're stressed, your periods are not regular.
Mm-hmm.
There's a reason because your nervous system is not functioning the way it was designed to. For men, it's all kinds of things that don't work the way they should when you want them to. So we're going to keep this very PG. But if you think about when your body's under a state of stress, nothing else is going to happen. You've got to eliminate some of that stress and get rid of the quote unquote bear.
The nervous system also has to feel safe in order to create and sustain life. So just think about it this way. If we're being chased by a bear, we're not going to create a tiny human. If we're being chased by a bear, that also goes to the end of pregnancy. Your body's not going to relax to be able to have that baby. Ultimately, your body will go ahead and go into delivery mode or labor mode. But if you're stuck in that fight or flight, that's where things tend to stall during pregnancy or during the delivery process. It leads to longer delivery times just because the body is stuck in that fight or flight. And so we want that even balance, and we want to make sure that the body is in a parasympathetic state when we start talking about pregnancy and birth.
I think that's why there's such a big stress now on birth plans and knowing what it is that you want and starting that early.
Yeah, I think it's important, but also having an understanding that just because you have the birth plan, it may not go
Mhm.
as planned. So you need to have an A plan, a B plan, and possibly a C plan. And then ultimately being okay with whatever happens. And I know for me, like I am a big control freak. Like if something doesn't go the way that it's planned, like I tend to get really upset about it. But knowing that whatever happens, it is okay because that's what was supposed to be your birth story, but also having an idea of what you want so that way you can control the things that you can
Mhm.
control during that process.
And again, those contingency plans are part of the plan.
Mhm. So the nervous system, we're going to go over a little bit about what dysregulation looks like in a mom. So subluxation is basically an interference in the nervous system, and so it occurs when the nervous system has become overstressed and it's out of balance. And so the nervous system dysregulation refers to a malfunction or an imbalance in that nervous system. So what's happening is the brain isn't connected to the body, or it's connected, but those communications aren't happening the way that they should. And so we get dysregulation. So high levels of stress and constant activation of that gas pedal puts us in that fight or flight. And so subluxation can contribute to complications. What that looks like in the mom is it can be fertility struggles, hormonal imbalances, and common pregnancy symptoms. It can lead to elevated blood pressure, decreased blood flow to the placenta, potential adverse effects on the baby's development. Because, again, if you're stuck in that stressful state, whatever's happening to your body is going to also be passed down to that baby. So it can also create sluggish digestion. I can talk. Bloating, acid reflux, constipation. It can lead to a weakened immune response, lowered energy, less than ideal positions or alignment for mom and baby. And so this is really important when we start talking about taking care of pregnant moms. A lot of moms come in because they have pain in their lower back, or um, it's usually pain unless they know about chiropractic beforehand and they want to start doing prep work. But a lot of what we do in chiropractic is making sure that the baby has enough room in that pelvic floor and in that pelvic girdle, so that way when it is growing, it's not only affecting how the baby is placed in that uterus, but it's also affecting how mom is carrying that baby. And that goes, like, we can go into that a lot. But what we do here in our office through gentle adjustments and Webster's technique is to make sure that the pelvis is in its proper position. So it can also, if there's a dysregulation in mom, it can lead to neck and shoulder tensions. I mentioned lower back pain, headaches, and unfortunately, it can lead to a traumatic birth because of that optimal position not being there. And it can create postpartum um, concerns as well. So, what does a nervous system dysregulation look like in a baby? So, high amounts of stress during pregnancy, if there's high amounts of anxiety and inflammation during the prenatal period, along with stress and intervention during labor, those forceps, that vacuum extraction, the cesarean delivery, um, even just a traumatic vaginal birth can also be strongly associated with challenges with kids later on, like that perfect storm. So, an infant often comes into us with colic. They can have difficulty latching, or breastfeeding issues, reflux, constipation. As they grow and as they get older, it can lead to eczema, because remember, they don't grow out of things, they grow into other issues. So it can be eczema, respiratory challenges, chronic ear infections, asthma, allergies, obesity, and the list goes on. But we can also develop sensory issues such as ADHD, autism, speech delays, seizures, and the list goes on. And so, again, what we try to educate our families is you're not growing out of one concern, you grow into something and it may be
Mhm.
more severe. And so earlier intervention is better because the more that we can intervene, we can prevent further
Yeah.
issues from occurring.
The more we know.
A balanced and regulated nervous system leads to better hormone regulation, improved blood pressure and breathing regulation, stronger immune response, improved emotional regulation and a stress response, better sleep. That is one of the things our
Woohoo!
moms often report is that they're sleeping better. When we start looking at their HRV scans, it's higher for mom and baby, which is a huge plus.
Yes.
And then their co-regulation, which we're going to go into, has improved. And then optimal development and positioning for your growing baby. And so I also put this picture in here because this is our mom, Gina. She was trying to get pregnant for a little while. Was told that she may not be able to get pregnant naturally, but one of the coolest things about being under chiropractic care is pregnancy happens. And so she was able to get pregnant and she was able to deliver a happy, healthy little baby boy. And he's just so cute.
So adorable. We love our pregnant moms.
So, mom and baby's nervous system during pregnancy and postpartum, the baby's nervous system will mirror mom's nervous system. And so, this is called co-regulation. So, let's think about the mom that is super wound up, super uptight, super anxious, super just, what does their baby tend to be like?
Exactly the same.
Moms whose are typically cool as a cucumber, and it's not always that mirror like identical, but it's going to be common. I think about Sophie. Sophie's just
Yeah.
cool and calm and
Yeah. And the baby is too. Like the baby
yeah.
never cries.
Right. So it's just it's cool to see that mirroring happen, but a regulated nervous system for all families is so important because if all of the nervous systems in the household interact with one another, that co-regulation is going to happen. And so you also want to think of a time like when you're holding a baby. Baby's like super calm, it's super
Mhm.
relaxed. And then if you're uptight and you're concerned and you're scared, what
Yep.
happens?
They get stiff, they get anxious, and then they start to fuss.
Mhm.
Like, when you pick up a little one and they just kind of melt into you and you're like, "Oh." Like they feel you and you feel them.
Mhm.
So there is absolutely that co-regulation and it's actually really cool.
I just like that analogy because it's
Yeah.
like I love Blake, but when we first started dating and you would hand him a kid, he'd be like, "Ugh."
And what happens? The baby gets all stiff and no.
It's crying. The babies
Yeah.
always cry when I hold it. Well,
Yep. It's because you're nervous.
So this is a really cool slide for us. Like we can get super nerdy with it. We're not going to because I think that you can read it and see what's going on with the baby. But you guys, like the human body is so incredible. Like I don't think we give it credit for anything. Well, we give it credit, but I don't think we understand all of the capabilities
Mhm.
of what the nervous system does, what the body does, how it works. But one fun fact is during the first trimester, as your cells are dividing and multiplying and creating this little baby, during week 3 is when the nervous system starts to develop. And oftentimes, this is before moms find out that they're pregnant. So
Mhm.
at 3 weeks, that's before that missed period happens. That's super early. And so the neural tube is starting to develop. And this is where we want to make sure that mom is healthy. We want to make sure that there aren't any neural tube defects that would lead to spina bifida. And we can go through that, another time. But this is why when you're speaking with your OB, they start talking about taking prenatals and they start taking, like, you want to do that months in advance before that pregnancy starts because that baby's already growing and forming before you know that it's even there. So weeks 5 through 8, we start getting major development of organs. During week 6, we start to see the sympathetic nerves and social development. During weeks 9 through 12, the digestive system starts to form. Week 11, the brainstem starts to form. Then we get to that second trimester, weeks 13 through 16, bones and muscles are forming. Week 17 through 20, we get hormones. Week 17, we get the cerebellum. Week 26, the vagus nerve myelinates. So each trimester, we're affecting that nervous system. We're impacting how that nervous system is developing. We get to the third trimester, week 29 through 32, your immune system starting to develop. Weeks 33 through 36, you have rapid brain development. Weeks 37 through 40, the lungs are fully maturing. That's why when a baby is born preterm, they start giving it surfactant to make sure that their
Yeah.
lungs develop and they can handle the outside world. Week 37, the autonomic nervous system fully develops. This is when the um, baby is out of the birth canal. That's when it's really starting to function. And then week 40, vagus nerve and immune system mature. And so, you want to make sure that the body is regulated. But when we start talking about the nerves of our nervous system of the mom, we really want to make sure that she is functioning to her fullest potential, because everything that she's doing and everything she's experiencing, that baby is going to be experiencing as well. So super, super important to have that understanding, not get stressed out about it, but understand like whatever you're being impacted by ultimately affects that newborn baby.
So can I share a fun fact?
Yep.
I did not know this, and I have had 2 babies myself, but I learned that when mom goes into labor, the hormone that actually induces labor is produced by the baby's brain.
Mm-hmm.
The baby knows when the baby is ready to be born.
Mm-hmm.
And that blew my mind, because talking about inductions and planning for these births, prior to 40 weeks, like, again, don't get hung up on the number, because that
It's
baby
an
knows.
estimated due date.
Yeah, because again, most of the time that baby is starting to form even before mom knows that there's a baby.
Mm-hmm.
So the baby will secrete the hormone that induces labor when the baby's nervous system determines that it's ready to be born. So keeping that in mind, like, obviously you're going to take the advice of your medical professionals,
Mm-hmm.
but don't underestimate your mom gut. That intuition is strong for a reason. So I always tell mamas, like, you decide what's going to be best for you, but know the facts as well,
Mm-hmm.
and then put that into your planning. So I just thought that was super cool, and I just learned that last year.
It is amazing. So, why should a baby be adjusted right after birth? And I think this is one of the best questions that we get. If you do a tour in our office, you will see that we have handprints on the walls. You'll see the age of the child that came in. You'll see pictures on our wall of babies getting adjusted. You'll see adults getting adjusted. So why is it important that your child gets adjusted right after birth? And so, even the most peaceful birth can be stressful on that child's nervous system. And so we want to make sure that the baby's nervous system is fully balanced. We want them to be able to adapt to being on earthside. Guys, we can't control everything. When we start talking about statistics and how a baby is born, we do know that a vaginal delivery unassisted, so hands off, is going to be the best optimal birth for that baby. But even that vaginal delivery places 30 to 40 pounds of pressure on that baby. When you start talking about a cesarean section, that places 60 plus pounds of pressure on the nervous system. And then we talk about cesarean sections, it's very stressful on the baby and its nervous system, because a lot of the times when they go to reach in and grab the baby, they grab whatever they can to pull that baby out. And that places a lot of stress and tension on the upper cervical spine, on that baby's overall spine as well. And so we want to make sure that we intervene sooner, making sure that nervous system is fully functioning and that there isn't any interference or subluxation. And so when mom and baby come in, they get to be adjusted, and it's also a marathon for recovery. We see a lot of moms who have been adjusted through their prenatal period, during their pregnancy, and then they come in a lot of times within that first week. I've even had moms like leave the hospital and come straight here to get adjusted before going home. So we often check mom and baby just to make sure that they're recovering before they get home.
Just gives the baby the best start, and mom, it helps calm her nervous system too, so that she can go and be the mom she needs to be, and dad can be nervous for a little bit.
He can get adjusted too.
He gets adjusted too.
So what is neurologically focused prenatal chiropractic? And so we get this questions a lot. You know, a lot of people think that when a baby gets adjusted, it looks like an adult. It does not. A lot of times it's very small amounts of pressure. It's safe. It's gentle. The amount of pressure that's being applied to that baby's spine and that baby's nervous system is the amount of pressure that dimples a skin. So it's very, very light touch and it's sustained contact. But that will help balance both sides of the mom's nervous system and the baby. It's a different approach from traditional medicine. It's an update, like, so when we start talking about traditional prenatal chiropractic versus nervous system focused, it's going to be a little bit different. We're going to be talking about how the nervous system is being impacted versus just kind of like crunch them and send them out. So it's a little bit different. And then it can impact the growing baby's nervous system, like we talked about it in utero. Like, so anything that mom is being exposed to, if we can make sure that she's transitioning appropriately, so is the baby. So if you are not a client here in the office, if you want to know what your next steps are, it all starts with your HRV and your insight scans.
So the scans help us see where your nervous system is today, and it allows us to track your progress as patients go through care. So a lot of people will ask, you know, obviously we're not going to do x-rays on kiddos. No. We're not going to x-ray pregnant moms. Nope. So these are the most adaptive scans that we can do that are non-invasive, and they're 100% safe.
And we can do them often. Yes. Whereas x-rays, you can't. Like, x-rays are ideal to see what the structure or what's happening in the structure of the spine. But the insight scans, we could ultimately, if we wanted to, do them every visit to see how the adjustment is impacting the nervous system. So it's safe, it's effective. If we're not seeing improvements, we can be a little bit more specific and dial in those adjustments more.
It really helps us take a proactive approach to helping people get results as soon as possible. So you're going to get what you put into it. So the scans help us see where the nervous system is today, and then we can create a care plan to follow, recommendations, and we can track that to see if it's working. We don't have to wait for months and months to be like, oh, did the pain go away? We can see immediate results. And, patients that are active now see that every time, and they can't wait to see the results of those scans.
Let me see my scans.
Let me see the scans from before, and we can bring them up and do a side-by-side comparison. And like, when you can have a tangible proof, especially for an infant who can't tell us they're in pain.
Right.
There might be visible signs. There might be tension. There might be reflux. There might be colic. But that baby doesn't know. And so we can scan an infant who can't tell us what's wrong and get an idea of where those subluxations are. And then Dr. Jamie can make adjustments, and she can work with that baby. And a lot of times within just a few adjustments, we start to notice what we call the soft signs. Better sleeping, better pooping, better eating. Babies aren't doing a whole lot else. Like, they're literally eat, sleep, and poop.
Yep.
That's their job.
And they typically respond a lot quicker than an adult would too, because of the the amount of time that their spine and their nervous system hasn't been impacted by
Right.
life.
And they're not sitting at a computer all day or sitting in traffic all day. They don't have all these habits that we have. They're not looking at a phone for 4 hours a day.
No.
So their bodies will adapt so much quicker. And when those interferences are removed, we can see it in the scans. And then we can tell, we'll ask some very specific questions like, are you noticing this? Are you noticing this? Like, even just weighing baby before and after they feed to know, oh, you know what? They are eating enough and they're thriving and hitting those milestones.
So we also know that a higher HRV reduces maternal stress. There's better sleep quality. There's an improved cardiovascular health. You have improved immune function. So maintaining that balance in your autonomic nervous system is essential for supporting proper blood flow to the placenta and optimal fetal development. We've seen with a lower HRV, imbalanced or stressed autonomic nervous system, which can lead to various health issues, which are commonly leading to a high risk in pregnancy because, again, that lower HRV means that you're stuck in that fight or flight or that sympathetic overdrive. So, any professionals working with pregnant women need to be using HRV technology so that they can see how that mom is adapting to its outside environment, so we can see what's happening internally as well. So tracking your HRV throughout pregnancy. These are images with a series of 3 HRV scans performed on a pregnant mom throughout her pregnancy under chiropractic care. So do you want to go over the scans?
So I keep flashing this card. This is an up-close visual of what it looks like. So on the first scan on the left side, you see that little white dot that's in that orange circle on the left side of the graph. So we call this a rainbow graph. The left side is your sympathetic nervous system. That's your gas pedal. That's your fight or flight. The right side is this parasympathetic. That's your brake pedal. The green zone towards the top of the graph is the ideal zone. Now, most people, most adults don't come into the office in that green zone. I see the majority of them on that left side and more towards the bottom. And we call that zone 3. And that is a zone of distress. It means that there is typically chronic stress. The body's in fight. Now, let me put this into perspective. This scan is done with at rest, not talking, not moving. So you sit for 3 minutes. That data's collected. You should be at rest when you're at rest. This scan shows someone who is very deep in fight or flight, even when they're sitting still with no external stimuli.
Yeah, we shut the door and you're sitting there with your own peaceful thoughts.
And sometimes you're even left alone. So then as we go through this journey and we scan mom next time, you'll see not only has that dot moved up into the yellow, it's closer to that center line. That's our goal. We want a nice even balance between parasympathetic and sympathetic and as close to that green box as possible. By that third scan, mom's right on that center line. She's a little bit to the left, but again, she's growing a human, but she has made considerable improvement if you look at scan 1 to scan 3. And this is exactly what we look for. And this is why our patients get so excited to see the scans because they can see the progress. They know that they feel better. Maybe they're sleeping a little better. Maybe their, morning sickness has started to dissipate and now they're starting to feel a little more energized and a little less nervous. But also what's happening is co-regulation. Now baby also is not getting fight or flight. Baby's not getting flooded with hormones with cortisol and adrenaline. Baby's getting more melatonin and serotonin and dopamine. So baby's co-regulated also. So again, what do we do when we're co-regulated? We thrive. We hit our milestones.
And the other thing, so you're seeing that there's 3 separate scans through the pregnancy process. You guys, healing takes time. It's not just one adjustment that fixes and corrects everything. Yes, the person is impacted by that one adjustment, but it takes that series of adjustments. So we're getting that body out of that fight or flight, putting it back into a parasympathetic state so that the body can heal. And so a lot of times people get frustrated because they want to see that improvement right away. Well, it didn't take overnight to get you to where you're at. And so healing does take time, but we typically do scans roughly every 12 visits or 30 days. Or if someone's in a wellness phase where they're less frequent, we do those scans less frequently as well. And it's going to take that time and that consistency to see improvement over time. So you want to go over the last scan? I didn't mean to.
Yeah, no, that's fine. So by scan number 3, we are just outside of that green box. Now, mom's actually closer to delivery than she was before. And so even though she's still growing a baby, she's getting that birth plan together, she's got a lot going on, her nervous system is regulated more and she's calmer. And now that helps with being able to transition into birth and delivery.
Mm-hmm.
So when the body is prepared, then baby is growing, baby knows, all right, now it's, as baby starts to drop, we know that that's the signs that delivery is, and it's approaching.
Mm-hmm.
So the more we can keep mom regulated, the more regulated baby becomes, the easier birth and delivery are for both.
Mm-hmm.
So, and then we also do postpartum scans.
Yep.
And we see a higher rate of this third scan in our postpartum mamas who have been with us through the majority of their pregnancy. And it's just their bodies recover quicker and they tend to be more well rested and a little more well-rounded as far as emotions go.
Mm-hmm.
Less postpartum depression,
Yep.
less postpartum anxiety.
Right, because their nervous system is regulated and they're not being chased by the bear all the time.
The bear is gone.
So Stephanie touched on this a little bit earlier. So as a patient who is pregnant under care in our office, our care plans are very personalized to that mom's needs. And so after you get that insight scan, we're able to put together a customized and personalized care plan for you that will lead you through that pregnancy period. Each and every adjustment, I'm trained in making sure that we address that subluxation and that dysautonomia directly. And so we're going to be focusing on what that scan is showing us so we can directly impact that nervous system. And so the first improvements pregnant mamas tend to see, I think Stephanie's mentioned this a few times, is they see better sleep. They see better digestion, less aches and pains, less pregnancy brain. So they're better focused. And from there, the brain and the nervous system can get back on track developmentally and benefit both the mom and the baby through that pregnancy period. So we have a couple of testimonies, and I'm just going to briefly talk about who they are and what they came in for. So Chelsea has been a patient of New Journey Chiropractic since we opened. And so at this time of the recording, New Journey Chiropractic has been open almost 7 years. So we met Chelsea when she had 2 babies. She now has 5. This is baby Jade, who was her 4th baby and first baby girl. But Chelsea knew the importance of making sure that she was under chiropractic care prior to getting pregnant and through that pregnancy period. And so she talks about how not only did it help her with pain and attention and focus, but it allowed her to be the best mom to her 3 boys, but it also helped her through that delivery process. And Chelsea's one of those super moms that she has delivered all of her babies at home. 2 of them were with a midwife. The 3rd one, midwife got there just as he was coming. And then babies 4 and 5, midwife didn't make it on time. But babies are healthy, they're happy. And, when we talk about Chelsea's delivery, it's 3 hours start to finish. It's insane. But it goes to show you that when your body is functioning and it knows what it needs to do, it can. And so she'll tell you about all of the importance of getting chiropractic care, but keeping your babies under care as well. She brings her children in so that they can get adjusted and stay healthy. This is mom number 2. I don't know why I picked 2 Chelseas, but I have 2 Chelseas here. And this is mama 2 Chelsea. And she had baby Alex. She came in here when she was 18 or 20 weeks pregnant. She was dealing with some sciatic issues. What she saw through chiropractic care is not only did she see improvement in her sciatica, but she was able to have a healthy delivery. She had a hospital delivery and it went well. So, it goes to show you what chiropractic can do. It's not just about pain, it's about making sure that the body is fully functioning.
Not to mention, we get to love on those squishy babies when they come in, and that's one of my favorite things in the whole wide world.
If you want Jamie to get sidetracked and behind on her schedule,
Bring a baby.
Babies. So
we love what we do.
Guys, it's really important to find your circle. And so we mentioned this earlier. Some of the key points that I want you to pay attention to when you're finding that inner circle. Find people who are going to empower you and to support you through not only the prenatal period, but through the postpartum period as well. So you want to start looking at providers that you're surrounding yourself with. Guys, I always recommend getting people who are going to follow that birth plan and be that biggest supporter behind you. So you also need to pay attention to how are you gaining knowledge and prepping for pregnancy? What are you learning? What are you going to be learning about the baby as you're developing this human inside you? What are you preparing your body for during birth? What are you preparing for postpartum? If you're flying by the seat of your pants, more power to you. But the more that you know, the more you can understand what's happening and the why behind it. You want to also know your birth plan. So, what resonates with you? Do you want to be in the hospital with an OB? Do you want to deliver there? What are your reasons why? Do you feel like it's more safe? Start asking those questions earlier. And there's no judgment, there's no right or wrong. You have to do what's best for your body. Do you want a midwife? Do you want a home birth? Do you want to go to a birthing center? Understand the whys and then make a plan B. If X happens, then Y happens. So understand all of those pieces. You want to make sure that you're moving, getting exercise, eating properly. Find providers that are on your team. I think we've mentioned this 1,000 times and even 2 seconds ago. Find people who are going to empower you and support you through this process, because the more that you have that empowerment and you have that knowledge, the better experience you're going to have through that birthing process.
Yeah. And when you've got a great support system, this is a question we ask all of our patients, not just our mamas, but when you've got a support system, then you know that everybody is helping you towards your ultimate goal. And if the support system is lacking, then start asking.
Mm-hmm.
Ask for recommendations, ask for referrals. Say, hey, who else might I need that maybe I'm not thinking of? Because then, if I had had this kind of support through my pregnancies,
Mm-hmm.
holy cow, it might have been a different experience. But I had good experiences. I just didn't know what all of my options were.
Right.
And my second pregnancy was induced, and I could have probably avoided that.
Mm-hmm.
So first pregnancy, no problem, 3 hours. She literally was here in no time. Second one was a little more, but not understanding is no longer an option because we have so many resources.
Mm-hmm.
So,
and as a new mom in our practice, you get a folder of all of our referrals that we work with, whether it's a OB, whether it's a midwife, whether it's a doula, making sure that you have that support team. Guys, I'm not the only provider that takes care of pregnancy, and I want to be just one piece of that puzzle on that team. And so a lot of the times when we start approaching families and talking to them, it takes a tribe to help support that human being. So we want to make sure that we connect you with like-minded providers to get you the goals that you want to achieve.
And if you are a provider in our community, we'd love to talk with you.
Yes.
We would love to connect with you and make you part of our circle as well. We're always looking to add people that are part of this community and bring them into that circle.
So if you're interested in becoming a client, or you're just interested to see how your nervous system is functioning, functioning, we'd love to help you get scheduled or signed up for that scan. All you have to do is scan that QR code. That QR code will bring you to our website and you can schedule an appointment. Just make sure that you put in the comment section that you came from the Birth and Beyond webinar. So that way we know that you watch this, and
Yeah.
then ask us any questions that you have. Like, we are here for you. You can shoot us a message, send us a text message. Our phone number is 386 236 8085. We'd love to address any questions or concerns that you have, whether it be through pregnancy or through chiropractic, or how it can benefit your family.
Yeah. Thank you so much for your time today. We know how precious it is, and we love to share this information and teach and educate. So we just really appreciate you guys taking the time.
So have a wonderful day, and we'll talk soon. Thank
Bye.
you.